Can you interpret this liver function test report of a 45-year-old male patient? If you don't know how to interpret the LFT, then continue to watch this video till end. Hello everyone. Welcome to today's video on one of the routinely advised investigation liver function test or LFT. These tests are essential tools in diagnosing and monitoring liver diseases. Let's understand the details and learn how to interpret LFT results. Starting with introduction to LFT. Liver function tests are a group of blood tests that provide valuable information about the liver health and function. These tests measure the levels of liver enzymes, proteins, and bilirubin in the blood. Commonly included tests are alanine aminotransferase, aspartate aminotransferase, alkaline phosphatase, gamma glutamyl transferase, total bilirubin, and albumin. Let's understand one by one about these parameters. First one is alanine aminotransferase, also known as ALT. It is an enzyme found primarily in the liver. Elevated level of ALT suggests liver cell damage. It is often the first marker to rise in acute liver injury, viral hepatitis, or drug-induced liver damage. Normal ALT levels typically range from 7 to 56 units per liter. Second one, aspartate aminotransferase or AST is an enzyme found in the liver, heart, muscles, and kidneys. Like ALT, elevated AST result indicate liver cell damage. However, because AST is present in other tissues, it is less specific to the liver. Normal AST levels range from 10 to 40 units per liter. AST and ALT ratio can help differentiate between different types of liver diseases. A ratio greater than 2:1 is often seen in alcoholic liver disease. Third one is alkaline phosphatase or ALP is an enzyme found in the liver, bile ducts and bones. Elevated ALP levels can indicate liver or bone diseases. In the liver, increased ALP levels often suggest bile duct obstruction or cholestasis. Normal ALP level ranges from 44 to 147 units per liter. Fourth one is gamma glutamyl transferase, GGT, is an enzyme involved in the metabolism of glutathione. Elevated GGT levels are seen in various liver diseases, especially in those involving bile ducts such as cholestasis. GGT is also elevated in alcohol abuse and is often used in conjunction with other tests to diagnose liver disease. Normal GGT levels range from 9 to 48 units per liter. Fifth one is bilirubin. Bilirubin is yellow pigment produced during the breakdown of RBC. It exists in two forms: unconjugated or indirect bilirubin and conjugated or direct bilirubin. Elevated bilirubins can indicate liver dysfunction, hemolysis, or bile duct obstruction. Normal total bilirubin levels range from 0.1 to 1.2 milligrams per deciliter. Elevated conjugated bilirubin suggest hemolysis or Gilbert syndrome, while elevated conjugated bilirubin indicate liver disease or bile duct obstruction. Fifth one is albumin. Albumin is a protein produced by the liver and is essential for maintaining oncotic pressure and transporting substance into the blood. Low albumin level can indicate chronic liver disease, malnutrition, or nephrotic syndrome. Normal albumin levels range from 3.5 to 5 grams per deciliter. Sixth parameter is prothrombin time, that is PT. It measures the liver ability to produce blood clotting factors. Prolonged PT can indicate severe liver dysfunction or vitamin K deficiency. It is often reported as an international normalized ratio INR for standardized results. Normal PT range from 11 to 13.5 seconds and normal INR range from 0.8 to 1.1. Interpreting the LFT patterns. LFT involves looking at patterns of abnormalities to determine the underlying cause. For example, in case of hepatocellular injury, there is elevated ALT and AST with a relatively normal ALP, suggests liver cell damage. Second, cholestatic pattern. This pattern includes elevated ALP and GGT with normal and mildly elevated ALT and AST. It indicates bile duct obstruction or cholestasis. Third one is mixed pattern. Elevation in both ALT, AST and ALP suggest both hepatocellular and cholestatic injury. Let's learn from some examples. Let's review a case study to illustrate the LFT interpretation. A 45-year-old male present with fatigue and jaundice. LFT results show ALT level 120 units per liter, AST 110 unit per liter, ALP 300 unit per liter, GGT 80 unit per liter, and total bilirubin is 3.5 milligram per deciliter. and albumin levels are 3 gram per deciliter. So from the above, the pattern suggests a cholestatic liver injury, which can be possibly due to bile duct obstruction or primarily biliary cholangitis. Further evaluation with imaging and additional test would be necessary for this definitive diagnosis. Second example, 30-year-old female present with jaundice and fatigue. LFT results shows ALT 1500 units per liter, AST 1200 units per liter, ALP levels 90 unit per liter, GGT 40 units per liter, total bilirubin 6 mg per deciliter, and albumin 4 gram per deciliter. In this LFT, as we can see, ALT, AST, both levels are raised and total bilirubin is also raised. This is significantly elevated ALT-AST with normal ALP, which indicate hepatocellular injury suggestive of acute viral hepatitis. Let's see third example. A 45-year-old male present with a history of heavy alcohol use. His LFT results are ALT 200 units per liter, AST 450 units per liter, ALP 130 units per liter, GGT 350 units per liter. Total bilirubin 2 mg per deciliter, albumin 3.2 gram per deciliter. Comment your interpretation in the comment box. As in this case, the AST and ALT ratio is greater than 2:1 and elevated GGT indicates that it's a alcoholic liver disease. Fourth example is, you should try this 50-year-old female with right upper quadrant pain present with the LFT results ALT 70 units per liter, AST 80 units per liter, ALP 400 units per liter, GGT 300 units per liter, total bilirubin 4 mg per deciliter, and albumin 4.8 gram per deciliter. So interpret this and comment the answer in comment box. One more example for your homework. A 55-year-old obese male with type 2 diabetes have LFT results ALT 80 units per liter, AST 70 units per liter, ALP 100 units per liter, and GGT level 60 units per liter. His total bilirubin 1.2 mg per deciliter and albumin levels are 4 gram per deciliter. So interpret this and comment your answer. One more example and then we conclude the topic. A 65-year-old female present with pruritus and fatigue. Her LFT results are ALT 90 units per liter, AST 85 units per liter, ALP 600 units per liter, GGT 500 units per liter, total bilirubin 2.5 mg per deciliter, and albumin is 3.4 gram per deciliter. In this case, elevated ALP and GGT with normal to mild elevated ALT and AST. This is suggestive of cholestatic liver disease. In summary, liver function tests provide crucial information about liver health and the function. Remember to consider the clinical context and other diagnostic tool when interpreting the LFT results. Thank you for watching. I hope this video has clarified the interpretation of liver function test. Do not forget to like, comment and subscribe our channel Medical Guruji for more medical insights. See you next time. Till then, take care. Bye bye.